Can we go public? There we go. This is a meeting of the Health Occupations and Long-Term Care Subcommittee. We will be touching upon both aspects of our jurisdiction at this meeting today. We have two bills, House Bill 464 and House Bill 1122. We'll do them in numerical order. First bill is House Bill 464. Council.
So both of these bills were discussed yesterday. There is nothing new in the proposal for House Bill 464. The bill specifies that the practice of audiology means to use any means known in science of audiology to evaluate, diagnose, manage, and treat auditory or vestibular conditions in the human ear, prescribe, order, sell, dispense, or fit hearing aids to an individual for the correction or relief of the condition for which hearing aids are worn, prescribe, order, sell, dispense, or externally fit a sound processor to an Osseo integrated device for the correction or relief of a condition, and prescribe, order, sell, dispense, or externally fit a sound processor. There are amendments that strike the language that would that breaks the language means known in the audiology.
Someone needs to mute themselves. I'm sorry, Council.
That's okay. The amendment clarifies that the definition is limited to removal of cerebrum that does not require anesthesia, that ordering cultures and blood work related to conditions of the ear, and is limited to ordering imaging related to conditions of the ear.
Thank you, Council. Delegate Bagnall.
Thank you, Mr. Chair. And I think yesterday we moved the amendments. Is that correct?
That is correct. You did.
Yes.
Can I move the bill as amended?
You certainly can.
Okay.
Being unaware of any, well, I should be quiet since the amendment, there's a motion before us, which I appreciate. Is there any discussion? All those in favor of the motion to move the bill with the amendments, say aye.
Aye.
Is there anyone opposed? The motion carries. Delegate Martinez, do you wish to speak?
Yes, Mr. Chair. I just want to thank everyone for their work on this. I know there was a lot of discussion, a lot of meeting, and I really do appreciate all the stakeholders and all the subcommittee members for their support on this bill as amended. Thank you.
Appreciate it. Thank you very much for your warm comments. House Bill 1122, Maryland Healthcare Commission Nursing Homes Acquisitions. Council.
So again, this is a bill we discussed yesterday. It requires a person at least 120 days before making a contractual arrangement for the acquisition of a nursing home to submit a request for acquisition to the Healthcare Commission and provide specified notice to residents and staff of the nursing home. The executive director of MHCC must review a completed request for acquisition within 60 days and in consultation with the Secretary of Health may approve the acquisition with conditions, deny the acquisition, or refer the request for acquisition to the commission for a final decision. I'm sorry if you guys can hear the squawk box in the back there testing the floor. So many, I don't know if I can change that.
No, I couldn't hear it. Okay, go ahead.
The amendments that what I distributed was the amendments that were distributed yesterday and the reprint that was distributed yesterday. The amendments clarify when the provider is required to provide notice of a change of ownership or submit a request for approval of an acquisition, require the executive director to complete a review of an acquisition request within 45 days, authorize the executive director to consult with the secretary's designee, require the commission to make a final decision on an acquisition referred by the executive director within 60 days, require notice of final decisions and reports to be provided to the long-term care ombudsman. allow a person acquiring ownership to temporarily delicense beds for 3 years to reduce the number of rooms with more than 2 beds. And authorize the commission to extend the 3 years for good cause shown.
Lisa, you're muted.
Sorry, I don't know how that got hit.
Okay.
They clarify the criteria the commission will consider, and they provide that the regs will apply prospectively. There was a new amendment, that the Healthcare Commission, after just, my understanding is after they had discussions with the, long-term care ombudsman, they are going to, when they solicit and accept comments from individuals, they are adding the state long-term care ombudsman to that list of who they will receive comments from.
Okay, thank you very much. So is there a motion before, is there a motion before us, council? Or no, on the original, the amendments from yesterday? And I know there's no motion on the amendment that we just received.
I don't think we did move the amendments yesterday. So.
Okay. Vice Chair Cullison.
Thank you, Mr. Chair. I would like to move the amendments from yesterday and have further discussion on the one that was just brought to us today.
Okay.
I mean,
seconded on the amendments that were before us yesterday. Moved and seconded by the vice chair and another chair, another chair. All those in favor say aye.
aye.
Aye. Anyone opposed? No one is opposed. Delegate Cullison, yes, to the next
Yes.
amendment.
On the second amendment, I'm wondering, this bill has been discussed for a long time, and this list has been discussed for a long time. I feel like there might be enough oversight with the group that we currently have, and the ombudsman is a part of the just reviewing and observing, as I understand it. Unless I'm wrong, it's not necessarily a part of this process. So I guess I have questions about the new amendment, is what I'm saying.
Ms. Ellis?
Thank you very much. And I'm the state ombudsman. My name is Stevan Ellis. The reason I asked for the amendment is that we are the only entity that goes into nursing homes and assisted livings regularly. We go into nursing homes at least once a month to do regular visits, to talk to residents, families, and staff. We also handle complaints, and we try to resolve them. Nationally, we also I talk with my peers that do the same work. There's 53 of us across the country, and we're familiar with companies in other states. And we actually talk to each other on a regular basis, several times a month, and sometimes about other companies. So I think we can provide, I can provide, whoever's in my role can provide a lot of insight into acquisitions, providing information for consideration, just like resident families and others. And also the next part of the law talks about the Attorney General's office, but also we would also be talking about what's in the public interest, because we know that once it would help with protections and possibly limit us if there are businesses that probably should not be doing business in Maryland, but also we may have good things to share. So it's not all bad. And it would be fact-based information. I apologize. I wasn't involved in some of the discussions with MHCC other than on the Nursing Home Acquisitions Committee. But I really would hope you all would appreciate that, because we are, again, the only agency that visits nursing homes on a regular basis, and not just for complaints. So I really appreciate you all taking the time to hear what I have to say and considering this amendment. And thank you all.
Ms. Aricott from SEIU.
Thank you, Delegate. I just want to remind the committee that skilled nursing home facilities are behind on actually completing those surveys that are mandated. And state ombudsmen have been the ones that are still attending and advocating for residents in nursing homes. And so they have a unique perspective on what happens when acquisitions happen. When ownership changes, often the first thing that is also changing is quality of care, staffing. And I think it would be really wonderful to have the ombudsman as part of that process to make sure that the Attorney General has all of the information they need when acquisitions happen.
Dana Kaufman.
Sure. So again, this has been a process that has gone on all summer long. And this is the approving of the acquisition, which we've already transferred to the Maryland Healthcare Commission. There's nothing that would prohibit the long-term care ombudsman from voluntarily providing their opinion to the Maryland Healthcare Commission, but we don't think it should be mandated in statute. We've got a lot more entities now involved in looking at these, and I think we're overcomplicating this. And I will also point out that in the legislation now, there is a lot of provisions, not just on the acquisition itself, but on ensuring post-acquisition quality. So I don't want that to get lost. So I would ask that, we have a lot of work going into this, that the amendments that have been agreed upon and worked on for months now with the Maryland Healthcare Commission.
Delegate Kerr, sponsor of the bill.
Thank you, Mr. Chairman. The amendments that you just adopted were the result of lengthy conversations over a period of time, and I believe that those amendments do make this a solid piece of legislation. Unlike the amendments we're discussing now, where we really haven't had an opportunity to consider the implications of these additional members of the review. So I think where we are right now with the amendments that have been adopted would be my preference to stay there. Thank you, Mr. Chairman.
Thank you. Thank you. Delegate Morgan.
Thank you, Mr. Chairman. I wanted to chime in too and kind of echo the message the bill sponsor just said. I'm not really sure how the ombudsman really improves the bill or tries to make this process easier. There's been adequate notification when there's an acquisition in effect, and I don't think the ombudsman is necessary in this bill.
Thank you, Delegate Morgan. Delegate Bagnall.
Thank you, Mr. Chair. And I kind of want to echo my colleagues' comments, because this, the amendments that we have voted on and considered, they are the result of lengthy work. And I very respectfully think that it would be a disservice to all the people who have provided their hours to sort of upend that in the 11th hour as we're considering this legislation.
Thank you, Delegate Bagnall. Delegate Cullison, your hand is still up.
Mr. Chair, I'm using my phone and I can't figure out how to lower my hand. So
You are excused. You are excused. Is there a motion on the amendment?
Well,
Chair, seeing no-
Mr. Chairman, do you want to, the maker of the motion, do you want to give an opportunity to remove the motion, or? Because personally, I'd like to move unfavorable,
I'm
but
sorry.
we don't typically do that.
Did anybody even move we
Yeah.
were discussing it. I don't think anybody's moved the amendment, so you can just, I think, move
That's-
the bill as you already have amended it, which was.
Okay, so there's no second on the.
There's no motion before us.
Okay, so I would move
Council is
favorable.
confirmed. Yeah.
I would move favorable on the bill
As amended by the
Previous
amendments
amendment.
already passed.
as the amendments as were previously adopted.
Second.
Thank you very much.
Second.
Moved and seconded. All those in favor, please say aye.
Aye.
Is anyone opposed? The motion carries. The bill moves forward. We are done, subject to the call of the chair, although, well, I better not say whether or not that's going to happen, the likelihood. So we're done. You're free till 11 o'clock. Thank you all very much. Thank you, Council.